The United States is in the grips of an opioid epidemic.
President Trump taking aim at the opioid crisis in the country.
The heroin epidemic in America.
We are seeing more people killed because of opioid overdose than traffic accidents.
In 2016, more than 42,000 people in the United States died of an opiate overdose. Kentucky has been especially hard hit, with 1,400 overdose deaths in 2016 alone. But what is an opioid, and how does it work? Opioids are substances derived from the opium poppy. They are commonly used in medicine for their pain-killing effects. However, these pain-killing effects come with negative consequences. Opioids are highly addictive, and a substance use disorder can develop with long-term use. When opioids bind to the mu-opiate receptor in the brain, dopamine is released, causing pleasurable feelings and euphoria. Once a person is addicted, a lack of opiates in the brain causes severe withdrawal symptoms. I went to the Center for Drug and Alcohol Research in Lexington, Kentucky, to talk to Dr. Tom Murphy, an anesthesiologist who also works in addiction medicine, specializing in opiate use disorder.
I'm Dr. Tom Murphy, and I'm an anesthesiologist, but as you can see from the diplomas behind me, I'm also an addiction medicine doctor. My interest in addiction medicine started mainly when I came to Kentucky and I started giving anesthesia to patients for heart valve operations. And they were average people, some of them from Eastern Kentucky, and they were injecting opiates, usually the oral opiates that were dissolved and crushed and dissolved.
So pills. But how did we get from pills to the current problem, heroin? In the 1990s, doctors turned to drugs like OxyContin, Vicodin, and Percocet to remedy what was seen as widespread undertreatment of chronic pain. Opiate prescriptions rocketed from 79 million in 1992 to 217 million in 2012. Pharmaceutical companies actively marketed to doctors to try to get them to prescribe as many painkillers as possible.
Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%. They don't wear out, they go on working, they do not have serious medical side effects. And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Millions of pills were pumped into Kentucky to treat the chronic pain of hardworking coal miners and others. As opiate prescriptions skyrocketed, the federal government stepped in to force pharmaceutical companies to make the drugs harder to abuse. By this time, millions were already addicted. Then heroin came back, in a big way. Heroin became a cheap and potent and readily available alternative to prescription painkillers.
The current opioid use epidemic started with painkillers. Legitimate pharmaceutical companies marketed painkillers to doctors as a treatment for chronic pain. Unfortunately, it was never proven to be an effective treatment, and a significant number of patients became dependent and addicted to prescription opioids. When regulatory bodies recognized this disease, they required pharmaceutical companies to change the formulation and reduce the ability to misuse these medications. This prompted a shift to heroin. Fortunately, there are treatments for opioid use disorder. Notice that I use the term opioid use disorder. Current medical terminology is using person-first terminology to avoid referring to patients with phrases such as junkie or addict. It's important to destigmatize this disease. It's a brain disease, and it doesn't discriminate. It's not a rural disease. It's not an urban disease. It's a disease which affects everyone.
Fortunately, there's a successful new treatment for this disease, Suboxone.
Suboxone is a combination of buprenorphine and naloxone. Buprenorphine is a novel opioid developed in the 70s for pain, and which has been proven to be a very effective medication for managing, preventing craving for opioids and illicit use.
To learn more about this, I spoke with Dr. Stephen Johnson, a psychologist at the University of Kentucky who runs a recovery support group for patients prescribed Suboxone.
Suboxone is a medication that was developed to help people in medication-assisted therapy. It's the medicine that we give. It's actually a combination of two different medicines, and it does two things. It blocks the receptor sites for opiates so that if you're taking Suboxone, you can't get high from heroin or other opiates. And the other medication helps with cravings, and so when you're taking it, you don't have cravings for the drug, and you don't go into withdrawal from not having heroin or opiates. So the idea is if people are taking this medication, that they will not crave the drug and they will not have withdrawal from opiates, so that they can then have their mind available to do other things other than chase drugs or get high. In thinking about who Suboxone works best for, like any kind of recovery, Suboxone works best for people who are ready to stop using heroin or ready to stop using opiates of some form. And if those individuals have gotten to a place where they can make the decision, yes, my life is out of control and I need to stop doing this, but I can't because I'm dependent and I have these cravings, the medication works great for those people who have come to that decision that they want to make that change. And so if they can get into a program where the medication is prescribed and they follow the treatment program, there's huge successes for those individuals to suddenly be able to change their life around. Suboxone doesn't work as well for folks who are still wanting to use drugs, right? So individuals who are still seeking that high and still are wanting to have that head change and feeling change, the drug isn't effective because it's obviously they're not using it correctly. So for individuals who are still wanting to keep the option open for using drugs, then Suboxone is probably not a good choice or therapy for them. So I've been fortunate to see Suboxone work really well and transform a lot of people's lives. So for folks that have, basically there's two groups of folks I've seen Suboxone work really well for. Individuals who have had chronic pain, that have had back pain particularly, or surgeries, and then get addicted to opiate medication that they were taking maybe mostly from prescribed physicians to manage their pain, and they got dependent on the medication and it was no longer working to manage their pain, but yet they were addicted to the medicine. Suboxone has worked great for that. Now Suboxone doesn't have an indication for pain management, but what it does for individuals with chronic pain is it allows them to not take opiates and have a clearer head, and then be able to use other kinds of therapies that are effective in managing chronic pain, like PT, mindfulness, meditation, other forms of therapies that actually help with chronic pain. So that it's a great help for those individuals. It's also worked really well for people who I think have lots of support and got hooked on drugs or heroin, but have the ability to not be around those people once they start Suboxone. So individuals that are able to say, I'm done with this lifestyle, I'm done with being around people that use drugs, they can be on Suboxone, and if they have good support with family, friends, it works really well for them too.
In order to combat the opiate epidemic, accessibility to this treatment must be expanded.
So the benefit of having other providers other than psychiatrists offer this medication-assisted therapy, I think is a really good tool. Of course, anybody who's going to be prescribing the medicine needs to have the training and understanding of addiction, right? But that can go across specialties. It can go into internal medicine doctors, family practice doctors, anesthesiologists, pain specialist doctors. That group especially is another valuable resource in understanding addiction, understanding how to prescribe this, because the opiate pandemic, epidemic, however you want to describe it, that's going on is so huge that the more people that can understand addiction, the more people that there are more resources for people who are prescribing this medicine appropriately, the better off we are as a whole, I think. So it's important.